Hello, everyone. It's my pleasure to be here with you for the third time. These issues with the presentations are the obvious Mac and Windows stuff that we go through each time we have to change, so I hope that it will work nicely. Well, I am supposed to talk about my experiences and my private experiences in almost completing my residency, so I hope that you will also find it kind of, in a way, interesting, maybe. I don't know. We will see. Well, being an OBGYN was not my first choice. When I started studying medicine, I wanted to be a tropical medicine doctor. Everyone told me, well, that's great, but how are you going to practice in Poland? Well, I didn't know. But these problems were solved when I decided to take part in scientific circle meetings in an OBGYN clinic near where I lived at the time. And then I had my first classes in Obstetrics and Gynaecology at the university. I have to say that it was something like love at first sight. Maybe a bit crazy, maybe a bit blind, but I decided that I will never ever be a gynecologist. At that time, one of our consultants in perinatology told me that I should really think about it because I would really suit that branch. But I told her that I don't want to wake up every morning thinking that what I do was unjust or immoral. Then for a little time I was thinking about being a pediatrician. But going through an internship in neonatology in northern Italy, I just knew that my place with these kids must be before their birth, prima nascita. So after more traveling and searching, meeting Natalia, who is the next speaker, I finally met Professor Hazan. And at the time when I finished my university and my obligatory internship, I already knew that the clinic that Professor created, and this is the website of the clinic, would be the perfect place for me to work, as I could learn a lot without the moral compromise. I got so much support as I started working. The first thing is that I was taught by the best professionals with good ethical background. Another thing was that I was supported in performing my research, and it allowed me to gain my PhD degree. I gained experience in organizing congresses with Professor, as we organized a couple of events in Poland at the time. I was allowed to take part in various congresses and courses, also as a participant. Even now it's always more difficult each time because I'm needed at the hospital, but at least sometimes they let us out. But first it was much easier. I got my nets and not a fish, so I was never allowed a fish if I didn't work for it. When Professor Hazan was the main consultant in obstetrics and gynecology, and I think it's really, really important, he banned a law saying that every gynecologist in training have to perform terminations of pregnancy. So we don't have to do it. Right now, we don't have to do it to specialize. Thanks to Professor, of course. And at the time, as Professor was dismissed, there are terminations taking place in our hospital. But in general, if a doctor doesn't will to take part in it, they don't have to. It basically means no taking part in the decision, no taking care of the patient before abortion, and no giving or prescribing drugs. However, we all agree that in case of hemorrhage or other complications of abortion, we are going to help the patients medically. I don't know if that may change with time. Probably it has to, because we won't pretend anymore that we don't see all these situations. I could see that after introducing terminations in our hospital, many things have changed. People became more tense, definitely. We all allowed more evil into our professional lives. After time of rebellion, which was really strong, there was time to search for reasons and excuses. Our friends decide about terminations. These are our friends, our colleagues, people who we really like. And so it's really difficult for us at times. We like these people, but where is the line? We've already seen some Catholic doctors who couldn't refuse prescribing prostaglandins or giving it properly to the patients. They were they are already consultants, and they stayed overnight in the hospital. They didn't know what to do. If they didn't do it, they probably would have to leave the hospital and would be fired. If they did, it would be a more compromise for them. So, well, I've seen these situations when, for example, I was the second gynecologist during night, and I said, okay, I am not going to do anything with this patient. And so there were another Catholic doctor who said, okay, so I'm going to do it. So these were the situations which were very difficult for me and for the other doctor, I think. So I think it's really tough for everyone, but sometimes probably we're not strong enough to say a definite no, especially in a situation when you stay overnight, and you have to be the one who says, no, I'm not going to tend this patient. Of course, it's different for me as a doctor in training, and I have more possibilities to say no, but also we don't have yet a definite approach for the doctors who are already consultants. They don't know yet what to do, how to react, and what should be done. They are on the first line of accusation if something goes wrong, so yeah, it's difficult for them. Our hospital doesn't perform IVF, and the basic training does not include IVF in Poland. I would even say something more. The IVF knowledge in Poland for now is something like a secret knowledge, and so you have to spend a lot of time and a lot of money to learn it. However, patients ask for it, ask for a solution for obstetrics at all. So if they have problems not only with infertility, but also with things like, I don't know, preterm births, they think that, okay, I'm going to have an IVF and it will solve all my problems. So if we talk to them and explain everything, it goes much better, and they also stay a bit calmer and don't push towards IVF. However, if you want to specialize in endocrinology, in gynecological endocrinology, which is one of the sub-specializations after gynecology and obstetrics, then you are forced to perform IVF. So if you finish your residency and you want to be an endocrinologist, then it's a strict part of the training to perform IVF. And so practically it's impossible to be a gynecologist, gynecological endocrinologist if you are a Catholic doctor. It's different with perinatology. They don't have terminations, but they don't have to do it, but you have to go through various hospitals, and in one of the hospitals, they probably force you to do it, but if you talk to them and try to go a bit around, then maybe you're not forced to do it. As far as oral contraception and intrauterine devices are concerned, it's important that the patients know before the visits what your attitude is. I find this solution, I think it's the easiest thing. In private clinics in Poland, it's possible to see the patients before the visit, so your registration can help. For example, I told in the registration that, okay, for example, I want to see pregnant patients and patients with this, with that, but I don't want patients who come for example, for intrauterine device. And so they say, okay, if the patient comes or they ask for if I can do it, they say, okay, the doctor doesn't perform this procedure, and that's easy. But if you work in public sector and in public hospital or in public clinic, then it's much more difficult, because it's all about the patient is not choosing the doctor, and the doctor is not choosing the patient. And so it goes a bit difficult at times. However, I know that there are doctors who are made and forced to prescribe oral contraception, and I heard that there are cases where doctors were fired because they didn't want to prescribe oral contraception. I had some situations where patients came for emergency contraception, In some cases, and I explain that it was impossible to get pregnant at a certain time of a cycle. For example, I had a 16-year-old girl who came with her mother, and she really, really wanted emergency contraception. And so I performed ultrasound, and I told her, explained to her, and it turned out that she was, in the late second phase of the cycle at the time. And so we all decided that, okay, we are going to wait. And she didn't get pregnant, so it was, a really, well, in a way, really for her, probably. But sometimes if you really focus on these patients and check everything that, very often it turns out that the intercourse was in the infertile time. So it's about, I think, at least half of the patients can go out of your office without, any further discussion. But of course, no time and sometimes no will to talk. It's a thing that, causes the problems. Sometimes the patients were really, really angry when they came out from my office, and so I had to transfer them to another doctor. So sometimes they were, going around and shouting that they didn't get what they wanted. But, I told them, okay, well, you can go upstairs, there is another floor of the clinic, and maybe you will find some help there. My husband is also an OBGYN, and a couple of months ago he was offered a position outside Warsaw as a chief gynecologist. And the first question he was asked, which is really interesting, was if he signed a declaration of conscience. Like the first thing, like he entered, they sat down and was like, okay, did you sign the declaration? And so he said, so he asked them, why are they asking? And he said that if he did, he wouldn't get this job. And so we luckily stayed in Warsaw, and we do what we did before. However, I don't want to be talking about what we don't have to do, what we are allowed not to do, but what we should really, really do. I found many of my Catholic colleagues being really passive in their professional lives, being very ordinary and not having ideas in their professional lives. Or thinking that they are the best and they are so transparent just because they are Catholic, which is usually very disappointing, as all humans make mistakes, and it's obvious. Complaining about everyday problems and about the situations that took place about something like 20 years ago, for example, like, oh, I was made to terminate pregnancies, are very common at Catholic doctors' meetings, unfortunately. It gives the worst impression for young doctors, but also for the patients. Being a Catholic doctor, in my opinion, should mean being strong and competent, even if the past was different. What future holds really depends on us and on what we do. If we do nothing and if we stay passive, nothing will change, definitely. If we start shouting, some may hear us, but some may not, as in the last lecture it was said. But what, in my opinion, must be done is everyday hard work in our society. I would like you to think about what can be done in 3 levels. The first level would be basic obstetrics. Have you ever thought of places where mothers actually die in labor because of lack of medical care, and so in fact because we are not there? I know that not everybody can travel to Africa or Asia to help mothers in need. However, many of us can, and many of us do. There are programs for various time, place, and duration of stay. Mater Care offers long stays, and it's also really important and I think very interesting. But also, for example, in Poland, there are other programs, governmental programs, which offer, for example, 2, 3, 4 weeks stays. And it's more or less something like you go there, you teach the people, for example, ultrasound, diagnostics, or for example, natural family planning for this time, and then you go back to your country and they can refer to you every time they have a problem with proper diagnostic. And I think that changing the world means changing the perspective of particular people. A couple of years ago, I thought that it's easy, that you change the word. How do you change the word? Well, I thought it's so easy, but now I know that it's about particular people and talking to particular people and spending time with them so that they also think that they are important. The second level would be, I called it natural family planning for clinical purposes, but it's not only that. Nowadays the speed of life and the demands of life gives to women, that the lives gives to women all around the world change the perspective of looking at the family, and that's obvious. Women in general want less babies and they want them later in their lives than the previous generations, and we also hear it in the office when the patients come to check up. In order to keep ourselves from always convincing the convinced, which is the easier part, we need to have an alternative for oral contraception and other artificial means. There are women who learn the natural means very fast, but there are some women who learn it with a lot of difficulties. For example, I work with a midwife who always talks to the patients, and she also teaches them the natural family planning if they want to get pregnant or if they want to avoid pregnancy. It's really good that I have somebody, so I talk to the patients medically, and then she talks to them for an hour, 2 hours, how long it needs. And then if there are any problems, of course we can communicate and decide about further things. And with this help and support, the patients learn more about themselves and how to appreciate their physiology and fertility. This knowledge is absolutely absent in general societies. Well, if you ask 10 people on the street about how many times do you have ovulation in your cycle, they wouldn't know. And it's crazy, but they don't know. I am a lecturer in classes with English division students, so the students from all around the world who come to Poland to study in English. And so I usually give them a 1.5 hour speech on natural family planning, and they usually go, with their eyes widely open, and it's like, oh, it's impossible that it really happens, because everybody previously during the classes told them that it doesn't happen, that it doesn't work, that it's that physiology is not like this, that only oral contraception is what matters, and it's scientifically proven, and not that you can observe your cycle. And once one of the students asked me a question after this lecture. She was sitting like that. And she was like, okay, so why do people get pregnant all the time if, there is a fertility window in the cycle and it's so short, in fact. And so, but they're really interested in that because for them it's something totally new, an alternative that they didn't hear about at any time. So if medical students don't know about it, then what about people who don't have anything in common with medicine? And for me, it would be important so that we do research in that field. This year, I was in Crete at the Fetal Medicine Congress, and one of our professors from Poland said, he had a very interesting speech about cervical insufficiency and elastography. And what turned out from this speech was that not only the cervix is important when it gets too short, but also the cervical mucus. And so I wondered if it's possible so that we kind of think about the ways of maybe doing some research on it and cooperating together, because maybe if we do that together, we would find out that, cervical mucus is what counts and not the tissue and the muscle of the cervix itself. In fact, this is what came out from this study, which was really extremely interesting. So I think that the world should hear it from us, definitely. And the third level would be going deeply into the matters. I would like to ask you now, how many Catholic professors do you have in your countries? Yeah, I thought so. So, you know, of course, it's really important, but because if there are situations which take place, and it is important to speak up for our opinion. There is nobody to talk about, you know, everything, and to, for example, to go to even to the television, radio, or write articles in that way, so that our opinion can be strong. Well, we shouldn't be afraid to talk and to be there for each other. Our opinion and your opinion really matters. It matters more if your position is higher, of course. So don't be afraid to grab the high position. I know it's not easy at times, but I think it's really important. Being an average doctor will give you average results, so do your best and be the best. But don't be afraid to listen to people who do science and have other attitude towards life and everything than you do. By going deep, I mean understanding modern medicine and getting absolutely all the best that it gives from the Catholic perspective. Why Catholic doctors can't be the best people in predicting the risk of and preventing preeclampsia many weeks before problems occur. You know, now all the world talks about preeclampsia, and so I think it's really important that also we do some research on that field and try, you know, to make pregnancy as long as possible for our patients. Another thing is the non-invasive prenatal diagnostics. So by taking maternal blood and using cell-free DNA, I'm sure that you all heard about it. Right now, there are more research in that field, and you can even diagnose diseases which can be cured very fast after delivery. For example, the George syndrome, which helps you to decide about how to deliver a baby. Because if the baby is born vaginally, then you can cause hemorrhage, intracranial hemorrhage. And in this case, you can do the test and know what to do. So you can always say that prenatal screening is used to search and destroy, so it must be banned. But thinking that way, you will never use a knife to cut bread, because it's a tool used to kill as well. So, you know, you should use what you know and know it wisely. And another thing I would really like to add is international cooperation. It's appreciated all over the world, and I think that also we should try to exchange experiences in our centers, so that maybe we can, you know, invite each other, so that we can see each other in various places and think about cooperation and maybe also some research together. So, I can't say if I made a right decision being an OBGYN, but I know that I couldn't be doing anything else in my life. It's a stressful and it's a risky job, but it's worth it. I still have my exams ahead, and I hope that with God's help I will do well. If I was to talk to my younger colleagues, I would say, respect others and let others respect you. Don't complain. Think about what can be done in case of basic obstetrics, research, narrow specialties, modern technologies. Manage your strong professional position and talk to your patients. In the end of my speech, I would like to thank Professor Hazan for all the support he gave me so far, and I know that I would never achieve my goals without his help. Thank you very much, Professor, and thank you very much for your attention, and please don't hesitate if you have any questions. Thank you very much.
Thank you very much.
Yeah.
Thank you so much for sharing that. Just whilst we're sorting out the technical aspect, does anyone have a question? Yes. Henriette.
Hello. Hello.
Hello.
So I just need you to clarify two things. I didn't quite hear properly. The first one, the non-invasive prenatal diagnosis. Just say a little bit more about it, because I need the information. And the other one, I wasn't sure I heard well, is what were you saying about, how does IVF manage prematurity? I didn't catch that one. You talked about the use of IVF in the management of prematurity. I'd like more information on that. And also, you talked about non-invasive prenatal diagnosis. I'd like a bit more information on that, please.
Okay, so I will start with the second question about the IVF. It was only a question from a patient. So a patient came and she said, "Oh, I delivered prematurely before, so maybe we will do perform an IVF as a solution for everything." Well, it's we all know that it's not a solution, but the patients ask sometimes really questions because they think that, okay, we have IVF, so we have a solution for absolutely everything. So this is only this bit about IVF. And as far as the prenatal, non-invasive prenatal testing, well, it's a thing that you take the maternal blood and you find the cell-free DNA of the fetus inside her blood. And it's mainly used for diagnosing the first trimester genetic problems like Edwards, Pateau, and trisomy 21 syndrome. So, these are normally used to search for these babies. But right now they added many things like microdilations and other problems which can be or cured inside the womb or cured very fast after the baby is born. So, of course, I'm not advising to use it as search and destroy in that matter, but maybe to try to use alternative methods of a broad spectrum of diagnosis before the birth, but to help the baby or to help the parents if the results go very wrong and very badly, that we can have the diagnosis very fast and help also the parents and support them. Thank you.
Thank you very much. We'll now go on to Natalia's presentation.
Good morning, dear auditors, dear guests. My name is Natalia Suszczewicz. I'm a resident in Obstetrics and Gynaecology at the Holy Family Hospital in Warsaw and a PhD student at the Warsaw Medical University. For the last 5 years since I first met Professor Wole, one of my dreams was to take part in Mater Care conference in Rome. Now this dream has come true in a form that I've least expected. Not only I can take active part in this meeting, but I also have the honor and a privilege of speaking before you today. I'm very happy and grateful for that. Thank you, Professor Wole. Thank you, Professor Hazan. I have a pleasure to present to you the work that was done for pro-life education of doctors and medical students in Poland for the last few years. The other point of this presentation is a little bit of my private story, why did I choose gynecology, and the question, is it possible to be pro-life obstetrician and gynecologist, and what else can be done for pro-life education. The general education of medical students in Poland, but I think also in the whole world, is very restricted in the area of pro-life restorative and reproductive health and natural family planning. There is a tendency to treat fertility as a problem or even a disease and to suppress it. Information about fertility awareness-based methods is often very narrow. only old methods and data and even misinformation. It's often said that natural family planning is unpractical, difficult, and ineffective. Although education of the physiology of fertility, menstrual cycle, endocrinology are the part of the medical study curriculum, this is often disconnected from any form of useful guidelines about biomarkers or cycle observation methods. The choice of family planning methods is a common problem that is faced by patients, sexually active women of reproductive age who go to the doctor, OBGYN. Doctors, especially OBGYN, could have a great impact on their choices. But can we call it informed choice? If medical students have almost no knowledge about fertility awareness methods and their education is mostly focused on contraception, medical students, it's me during my studies, medical students are overwhelmed by the vastness and extent of information. Often they do not even have time to verify what is being told to them. Although we look at the same word, the same information, the same evidence-based medicine, we often interpret them as we are instructed to. We do not see all the aspects of certain issue, but only those which are told us to see. As in the case of this picture, we look all at the same picture, but some of us may only see old woman. Do you see her? No. While other may only notice young woman. We look at the same word, the same information, but we interpret them in another form. We often do not see both. After such selective and subjective education, we become doctors and guides for others. When I was a student in my 6th year of medicine, at the end of the gynecology and obstetric classes, we were asked by a professor to evaluate the classes. I raised my hand to share my opinion, and I said in front of the professor and the whole audience of students that there are topics which are missing from our area of study, of OBGYN study, and which would be a great importance and of a great meaning, namely natural family planning, fertility awareness-based methods. The audience went silent, and the professor answered me, yes, maybe it could be quite interesting, but these methods are only used in Africa. At that time, I already knew that what he said is a lie. Back then, I was one of over 3,000 teachers of symptothermal methods in Poland at that time. Why did I choose gynecology? Because of my personal private story and because of symptothermal methods. I met my future husband when I was 17 years old. So during my medical study in the middle, 21, I was that time, I got married with him. He was during his mathematics studies and computer technology studies. So we wonder what to do, how to be a marriage during our studies. We wanted to wait till the end of our studies to be parents. We wanted to be students, but a marriage. So we asked ourselves what to do. And Martin told me, you will never take a pill. I will not let you to do it because it's unhealthy and it's unlogic. And it's also not like the church says us to. So we were searching in internet, in courses, pre-marriage courses, and we went through internet and we found out about symptothermal methods. So I went for a course. It was a normal course, not medical, with normal, ordinary people, not medical staff. And they asked me, so you are a medical student and you do not know about fertility awareness methods? I met the president of Polish Association of Natural Family Planning Teachers, and she told me, you need to put this faculty of Natural Family Planning on medical university. Who will do it? We need to do it. There are only few medical Catholic obstetrician and gynecologists, so you need to be a gynecologist, a Catholic one. So I didn't stop on that point. I found organizations and people of great authority. Professor Hazan, Professor Ewa Zwolinska, and they wanted to help to introduce natural family planning to the medical curriculum. I am very grateful to them for their special, important and huge work for women's healthcare and for natural family planning in Poland. Thank you, Professor Hazan. On this slide, I would like to emphasize that Professor Hazan had a great impact of my specialization, because I went to him when I was at the end of my study. I told him about the idea of natural family planning on medical university, about my pro-life curriculum, naprotechnology courses and so on, and he didn't tell me, you are bizarre. He told me, please come to my place, please come to this hospital, do residency here, I will help you. And he helped me a lot. Together, and thanks to students' organizations, we created free workshops for medical students through which we promoted natural family planning among medical students. We applied to the dean few times with our project of fertility awareness methods classes, having more than 60 students supporting the creation of an elective course of fertility awareness-based methods. At the beginning, the dean was not enthusiastic, but finally he agreed. A 30-hour fertility awareness methods course was established at the Warsaw Medical University in the academic year 2010-2011. As the first of its kind ever to be conducted at a medical university in Poland. Seminars, as you can see, include modern methods of fertility awareness based on observation of biomarkers of the menstrual cycle, an analysis of the actual card cycles using thermal methods, the diagnostic of disorders of reproductive health care, the harms of contraception, and of course reliable information about naprotechnology and the Creighton model system, as well as other topics regarding restorative and reproductive pro-life medicine. We put special attention to the fact that natural family planning could be essential and useful in the medical practice and in personal life, especially in the field of women's healthcare, prevention of reproductive health disorders, and the diagnosis and treatment of infertility. But we were one of 50 other elective courses on the medical curriculum. At the beginning, we were afraid. Eva, I think that you are somewhere on this picture also. We knew how looks the education, promotion of abortion, contraception in medical university. We knew that. We knew that students could be very skeptic on the beginning. We were very full and precise with our words and with our program. Year by year, we have become more and more popular. Now, we are here is Professor Wally also on the picture. He was a guest, I think, 3 times. Now we are totally unexpected, in fact, the most popular elective course for medical students during the entire curriculum at Warsaw Medical University. At the beginning, it was what we have least expected. Now, I would like to present you our study. You will see that medical doctors, future medical doctors, are interested in natural family planning, but we should give them possibility to know this. The aim of our study was to evaluate the usefulness of fertility awareness-based methods, course by its students, who are all students of medical fields. During the last class of this elective 30-hour course, an anonymous survey was conducted on a total of 186 participants. The surveys were conducted in 4 consecutive academic years. Survey questions comprise both choice questions and open questions. Coming to results. We asked the students what their motivation was to take part in the course. Please read some of their answers. You can see that medical students are interested in natural family planning. Personal conviction, necessity. My girlfriend would not forgive me being absent from the course. The selection of topics offered within the course was rated as very good and good by together 94% of the students. Most of the students assess their development of practical skills as very good and good, 90% in total. Most medical students claim that through these activities they gained new knowledge, 98% participants, and skills, 96 participants. According to the majority of students, this course was useful both in professional medical practice, 86% in total, as well as in personal life, 93% in total. As many as 96% of the persons said that the fertility awareness methods course was useful in their medical education. According to 93% of the respondents, the acquired knowledge that was obtained during the course was not available to them on any other course or subject on the curriculum within the regular program of medical studies. Classes inspired 92% of the students to continue their education in this field on their own scope. 94 of graduated students would recommend this course to a friend. A significant proportion of students, and especially a significant proportion of women, began observations of the biomarkers of fertility. We asked them also, on many pictures as Professor Hazan, because he's one of our teachers, we asked them also why would they recommend courses of fertility awareness methods to other medical students. Please look on their answers. They can, for example, look at the IVF problem from a different perspective. It broadened horizons. Conclusions about fertility awareness-based methods. This course for medical students was rated as positive and highly useful in the medical system of education, professional practice, and personal life. It was a valuable source of medical knowledge which was otherwise not available to the students on the curriculum. So we asked ourselves if it's possible to introduce fertility awareness methods to other universities, and we started to ask other natural family planning doctors to conduct workshops on their medical universities. And we also faced with problems that Ewa told you about passive attitude of Catholic doctors. But that time we had already proven highly usefulness of these classes at medical university, and we knew that it's good to start with open workshops. So natural family planning teachers and doctors conducted workshops in some places, some cities, medical universities. In Gdańsk, Poznań, Wrocław, these workshops succeeded in becoming fertility awareness methods electives. As far as I know, it's probable that Kraków and Lublin will start with regular fertility awareness methods course from the new academic year. But these classes, it's not the only thing that we can do. I encourage you also to start to do conferences on medical universities. We tried to do it, and it happened a few times in Poland. We encourage natural family planning organizations to help us, and we have a cyclic conference. The first was in October 2011 about beginning of life, and it was on medical university, and we focused on that the human life begins from the moment of junction, of fertilization. And you can see that mostly participants were medical students, doctors, and midwives. So they like to come for such conferences. These are pro-life conferences, but we do not call them directly pro-life conference. For example, the title can be around labor, around delivery in 21st century. This conference took place in 2012, and it was about positive family-friendly changes in obstetrics area, but also about annoying changes like cesarean section, increasing percent of cesarean section. In 2013, there was a cyclic symposium about reproductive health prevention, marital subfertility, and infertility. You can see that this conference is pro-life because we call marital subfertility. Yes, so there are some signs before, but then people come, and mostly doctors, and they can see other perspective. On that conference, we focused on ethical standards of diagnosis and therapy based on work on experience of Creighton model system, nanotechnology. And also doctors and medical students were there with us, and young people mostly. And the last conference was international scientific conference about human procreation. We had also international guests there, maybe you know some of them. As you can see, medical staff is interested about such conferences, so I encourage you also to try. Maybe you already tried to do such conferences. And the number of participants by year is quite good. It makes about 1,000 medical staff so far. So we are still on the road. The introduction of pro-life education in medical schools through Europe can be difficult, I can imagine. But it's worth considering and may be possible to introduce throughout not only Europe but also the world, because they have proven highly useful in medical university curricula. Or maybe on some medical universities there are already fertility awareness-based methods courses. Thank you very much for your attention.